Okay, now to the health report with Janine Grespan, and 'tis the season for prevention.
That's right, because it is at this time of year when the risk goes up for certain types of health conditions. Visits to emergency departments spike for different reasons at Christmas time. One of the top three is respiratory problems. The holiday period can create the perfect storm for people with COPD, Chronic Obstructive Pulmonary Disease. Preventing emergencies is the goal of an expanding community-based program to help manage symptoms.
Carol Tanner was recently diagnosed with COPD.
Just about 2 or 3 weeks ago.
She was already in the hospital because her symptoms were out of control.
Emphysema, and I had what I thought was a long-lasting cold that actually was pneumonia. So I had a whole bunch of things wrapped up in one.
You had a bit of a crisis.
Yeah.
Christmas is peak season for COPD emergencies. With the cold weather, the stress, and a lot more respiratory infections around, this is a risky time.
Currently, we have 32 residents out of 237 that are diagnosed with COPD.
That's 13% of the population at this long-term care residence. The chronic respiratory condition is a growing concern at these facilities.
It is one of the top health issues with elderly people. Absolutely. They are compromised, and respiratory is very prevalent.
Managing COPD symptoms is the focus of an expanding prevention program called PRISM. It is based at St. Mary's Hospital, but for the last 2 years, long-term care staff have been receiving education and training.
Because of our success, we decided to apply for further funding from PRISM so that we could make this a full program and bring it out to not only Forest Heights, but other long-term care homes in the community.
It's an outreach program with a personal touch.
I'll come out and work with the clients. I'm going to help build their education and exercise program. When we can educate both people with COPD and staff of long-term care, we're helping people to manage their COPD better.
Keeping them healthier and more active in their own communities and away from the emergency department.
I think I can cope with it, and with exercise, and I'm looking after my diet more now, so I'm determined.
And she'll do well. Nearly 150,000 people, though, in Ontario are living with COPD. Across Canada, it's the second leading cause of hospital admissions for chronic illness and kills nearly 10,000 Canadians a year. Well, to find out more about the COPD management and prevention program at St. Mary's Hospital and the expansion of its community-based services, you can see our website for links.
Very interesting, those numbers. I was not aware they were so high.
It's surprising. It's not as well known as heart attacks and other conditions that we hear a lot about at this time of year.
Interesting. Okay, thank you, Janine.
You're welcome.